All right, today we're going to talk about naloxone or Narcan administration using the mucosal atomization device and giving the drug intranasally. This is training for our EMTs and first responders. All right, what is naloxone? Naloxone is a drug used to reverse the effects of opioid medications and drugs. Opiate drugs are street drugs such as heroin, as well as prescription pain medications like fentanyl, morphine, Dilaudid, oxycodone, hydrocodone, and codeine. You'll find drugs like hydrocodone and oxycodone and a lot of the prescribed pain medication that we use like Percocet, Vicodin, or Lortab. Naloxone does not reverse non-opioid drugs like benzodiazepines, cocaine, methamphetamine, etc. So this cannot be used to reverse drugs like Xanax or Valium or Versed. All right, opiate overdoses. Basically, when you have an opiate overdose, this causes respiratory depression, decreased mental status, and in severe cases, apnea and even cardiac arrest. It does not take long for apnea to progress to cardiac arrest, so obviously we want to give the antidote for the opiate overdose as quickly as possible. Naloxone is very fast acting and it may be life saving if given quickly. There is a large push nationally to make this drug available to the general public as well as police and all first responders. Traditionally, it has been a drug given only by paramedics and in the emergency department, but if given properly in the field, it can be life saving. Missouri enacted a law in August of 2015 that allows Narcan or naloxone to be given by qualified first responders and lay people as well as police officers if used intranasally using the MAD device. For qualified first responders to give this medication, they have to undergo training from their medical director, which is the purpose of this video. All right, so how do we administer Narcan or naloxone? We carry Narcan on all of our pumpers and ambulances. Paramedics can give this drug IV or IO, but for EMTs and first responders, it must be given intranasally using the mucosal atomization device. When you use the MAD device, the medicine is sprayed into the patient's nose and it is absorbed quickly across the nasal mucous membranes and rapidly enters the bloodstream. When do we give this drug? We give this drug to patients with altered mental status who may have overdosed on opiates. It is safe to give even if you're not sure. So if you encounter someone with altered mental status, especially if they're apneic, and you have any reason to suspect they may have overdosed on opiate medication, it is okay to give this drug intranasally. It is very rapid acting and it can be life saving. So this is not something that we want to delay until the ambulance arrives. We want to give it as quickly as possible to the patient. So how do we give it? Naloxone comes packaged, as you see here, in a syringe that contains a concentration of 1 milligram per milliliter. Each syringe contains 2 milliliters of medication, so therefore there's 2 milligrams in each syringe of medicine. What we're going to do is take that syringe and attach the MAD device and squirt 1 milligram or 1 milliliter into each nostril using the MAD device. Additional doses of the medicine, if needed, are going to be given IV or intraosseously by paramedics on the scene. The protocol that covers this in our protocol manual is section 900.05. After administration of the medication, we need to provide supportive care. So we focus on the ABCs, airway, breathing, and circulation. This medicine works very quickly. It should be noted, though, that when the drug is given in the nose, it may be less effective than when given IV. So if you're used to seeing patients wake up dramatically with IV medication, it may be a little bit slower or less dramatic when you use the nasal route of administration, but it is usually very effective. The patient will usually show some element of improvement if their altered mental status is due to an opiate overdose. Remember, what we're trying to do is to reestablish adequate breathing and perfusion so they don't necessarily have to wake up fully for that to occur. So the drug is very effective when given nasally. Okay, this is our MAD device you see here. Comes packaged here, ready for use. This is how our Narcan or naloxone is supplied. See, we have a syringe here that has 1 milligram per milliliter concentration. It contains 2 milliliters of medication. So each milliliter has 1 milligram. So we have one milliliter for each nostril here. All right, so once we've opened the packaging, we see we have our MAD device right here. Inside the box, you have these two devices here inside the box for the Narcan. Here we have a glass vial that contains our medication. You see it's marked on the side, naloxone hydrochloride for injection. And you see we have some markings here on the side that indicate how much 1 milliliter would be to inject. And so we see we have one clearly marked on there. The next thing we have here is the device we use to actually inject the medication. You'll see it has a yellow cap on either end. What you're going to do is remove the yellow cap on this side right here. And then you're going to take your medication here. You're going to remove this red cap like this. And then this will screw into there and be ready for use. Okay, once we have screwed on the vial of medication here, we're going to remove the yellow cap on the end of the syringe here, and we're going to affix our MAD device to the end of this. Okay, and once we've done that, this will leave us with something that looks like this, and we're ready to inject. And so what we'll do is we'll come over to our patient here. You're basically going to go ahead and stick this device up into the nostril and basically depress the syringe down to the 1 milliliter mark. And when you're done there, you're going to switch it over to the other nostril, and you're going to depress the syringe and give the other milliliter up the nose here. Okay, to sort of give you a look as to what this device looks like. When we depress it, the syringe here, I've hooked a syringe of saline up to the MAD device, and when I depress it, you see it generates a very fine mist and basically atomizes the medication so we can give it up the nose. It's kind of like a very fancy squirt gun, but that's the mucosal atomization device. Okay, this completes our training. If you have any questions, please don't hesitate to contact me. But again, this is a life-saving medication that should be given by our pumper crews before the arrival of the ambulance. We should not be waiting for the ambulance to arrive before we decide to deploy this medication because it works very quickly and again, will save a lot of lives. So again, any questions, please feel free to contact me. Thank you very much for listening.